What started out as a pneumonia-like disease in Wuhan City, China late last year has quickly transformed into a global health crisis, verging now on a pandemic. As of early March, coronavirus infections have skyrocketed, over 80,000 cases confirmed, and even though the vast majority are concentrated in mainland China, communities worldwide are starting to see increased numbers of affected patients. Now in the U.S., the first accounts of person-to-person spread of the coronavirus are being reported in California, leaving medical providers and infectious disease experts scrambling to find ways to contain the deadly and highly contagious virus.
A lot of people actually did not know they actually have the COVID-19.
One of the biggest reasons why the coronavirus, or COVID-19, is so insidious is because it has many symptoms in common with a regular cold. But as infectious disease specialist Dr. Tin-Chin Chu describes, coronavirus patients can quickly develop more serious and life-threatening conditions.
One key symptom for the COVID-19 is the patient will experience the shortness of breath. That's one. And there is another possible symptom is to have the GI tract problems. So the patient may experience diarrhea. But when we say may, that means may or may not show up the symptoms. And in terms of the incubation time, so there is about, from CDC's data, is 2 to 14 days for the incubation time. But there are also cases they actually show up the symptoms later than that.
Dr. Chu added that even though the health risks of a coronavirus outbreak are high, there are ways to prevent against it without drastically altering your way of life or stigmatizing others.
We should be diligent in terms of self-protection, self-hygiene, but we should not be overreact about, we are worried about one thing is the xenophobic is coming up. So for all the infectious diseases, hand washing is actually one of the best way to protect ourselves, and then also to avoid a close contact with sharing personal items, even with your family members or the close friends. Those will be the top priority that we should do. And also, if you actually feel you're under the weather, if you have any symptoms, please stay home.
And as misleading reports circulate online about the coronavirus and its symptoms, Chu also recommended some reliable sources to learn more about the virus as it spreads.
People start to Google corona beer virus, and then people start to be afraid of even consume the corona beer. And this is something that we're talking about, the myth and the misinformation. So I usually, when there is any kind of disease-related information, I actually refer everyone to actually check the CDC data. That's actually the most updated. Usually they will do, right now they're doing daily update.
I do feel like, the odds are pretty good that we will start seeing more activity in the United States.
Foreboding words about COVID-19 from nurse practitioner Diane Lynch, the director of Seton Hall's Health Services Center. With the risk of an outbreak forcing all courses online indefinitely, Lynch says there's a plan intact to handle any cases that arise on campus.
We have a close relationship with the South Orange Department of Health. And they even help in terms of communication of, cases that might be occurring locally. So that allows us to kind of help prepare here. They would also be involved in helping us to mitigate situations here if we started to see cases.
Lynch also explained that even though the average college student isn't likely to deal with a life-threatening case of the coronavirus, taking steps to avoid it helps people who have a higher risk of suffering more dangerous health complications.
Unlike the flu, which probably is a more serious and severe illness, coronavirus is milder, but we have nothing to protect the people who are at risk for more severe illness. So while our university community in general may be low risk, we want to make sure that we're doing everything we can to mitigate the spread of the illness, to protect those people that are more vulnerable.
Here at Seton Hall, the university is also taking steps to protect students against the coronavirus already, including shutting down all spring break study abroad trips and handing out literature with information about the disease and ways to protect against it. Reporting for WSOU News, I'm Bob Toohey.